COVID-19 spreads mainly in two ways: direct close contact. One can get the infection by being in close contact with COVID-19 patients, especially if they do not cover their face when coughing or sneezing. Indirect contact. The droplets survive on surfaces and clothes for many days. Therefore, touching any such infected surface or cloth and then touching one's mouth, nose or eyes can transmit the disease. To portray how contagious the virus is, we consider a common scenario of a hospital. As per a report published by the World Health Organization, nearly 5,108,869 people have been infected from SARS-CoV-2, many of these could be prevented for as little as $1 per head. UV blaster can deactivate bacteria and virus that come in contact with its high-power UVC light rays. The UVC range covers wavelengths between 200 nanometers to 280 nanometers, is capable of eliminating viruses, bacteria, mold and spores.
This device useful for high-tech surfaces like electronic equipment, computers and other gadgets in laboratories and offices that are not suitable for disinfection with chemical methods. The product is also effective for areas with large flow of people such as restaurants, hotels, classrooms, offices, airports, shopping malls, reception area, ambulance, medical, warehouses and much more.
The system comes with 360-degree motion detection sensors to protect any intruder from harmful exposure to UV light. In case any motion is detected within the sanitization range of the system shut down within seconds, as a precautionary measure and notifies the user on the device of an intruder alert.